On Medcastplus, we aim to bring local healthcare providers and physicians to discuss important topics relevant to our health and well-being.
Good afternoon. It's truly a privilege to share a few words with you this afternoon to inaugurate our Diabetes Center of Excellence here at Kings County Hospital Center. It's creating more efficiencies in the manner in which we deliver care to our patients. All the diabetes-related services will now be in one location, which will provide a better patient experience. In addition to diagnosis and treatment, there are a range of services designed to improve patient experiences, such as lifestyle as diabetes education, coaching, to meet the patient's needs, and targeted health literacy gaps. I am proud to be at the helm of an institution that implements programs to enhance the overall well-being for our patients. We must continue to work together to increase awareness and to improve outcomes through education and treatment. This is our commitment to our community. I would like to thank Dr. Michelle Allen, our system CMO. I'd like to thank Councilman Eugene Matthew, who's been a humongous benefactor for our facility here. I'd like to thank the clinical leadership for the continued leadership as it relates to treating diabetic patients. I'd like to thank our capital design and facilities team for building this beautiful new space we have here. And I'd also like to thank the members of the team here who coordinated this event for us. So thank you and welcome.
Good afternoon. Good afternoon. I'm David Stevens, Chief of Ambulatory Care here at New York City Health and Hospitals, Kings County. For over 188 years, Kings County has been there for our community. Our Level 1 Trauma Center is known across the country for its ability to save the life of whoever comes to our door. Today, we commit to that same level of excellence for our patients with diabetes. But diabetes is not a sudden traumatic event. It takes a slow and relentless toll on our patients' hearts, blood vessels, kidneys, eyes, as well as their sense of well-being and their relationships. In our own central Brooklyn community, nearly 1 out of every 6 adults has diabetes, 1 out of 6. 1 out of 3 are at high risk for diabetes due to obesity. These numbers are much higher than New York City averages. 2 out of 3 people with diabetes will die of heart disease. People with diabetes have twice the risk of stroke. But these outcomes can be prevented. Our patients with diabetes can take medication that reduces their blood sugar to near normal levels. They can adopt a healthy lifestyle that reduces their need for medication and sometimes allows them to stop their medication altogether. This requires a team of doctors, nurses, and others. But in diabetes, the most important person on any medical team is the patient. It's what they do for themselves that counts. Taking their medication, eating right, getting enough exercise, and perhaps most important, adopting the right mindset. A mindset that says, I can do this, I'm going to do this, and I know I can do this because I'm part of a team of doctors, nurses, nutritionists, and even other patients that are going to be with me every step of the way. With our newly expanded diabetes center, patients will attend their doctor's appointments and on the same visit receive the education and support services they need to adopt their new healthier lifestyle. They will have a center to go to get advice and support whenever they need it. They will be part of a community focused on wellness. Our center will include many elements, everything our patients will need for their journey, including a drop-in program for patients referred from our emergency department with newly diagnosed diabetes, a medical management practice run by diabetologists that will include a special program focusing on achieving remission in newly diagnosed patients, our diabetes education program where patients go back to school to learn everything they need to take care of themselves, a full-service teaching kitchen where patients will learn to prepare meals that are healthy and delicious. The diabetes prevention program we will run will help patients and their families who are at risk of diabetes learn how to adopt the healthy lifestyles that have been proven to prevent diabetes. A full-service gym to help our patients learn how to exercise, And we're in the planning stages for a bariatric surgery program to help patients who, despite their best efforts, are not successful in achieving the weight loss needed to prevent and control their diabetes. This is a proud day for Kings County and for the health of our community, and I want to thank you for joining us. I also want to thank some key individuals who have helped us make this happen. First, our guest, Dr. Michelle Allen, our CMO for H&H, our CEO, Sheldon McLeod, our CMO, Stephen Pulitzer, and our chief nurse, Opal Sinclair Chung. All have been with us, behind us, every step of the way. The project has been managed and moved forward under the dedicated management of Senior Associate Director Diamati Singh. I want to thank my leadership team in ambulatory care, Vincent Mulvihill and Hyacinth Charles, as well as our facilities department, who has worked with us to keep this project on track. I want to give special thanks to nurse practitioner Suzette Williams, who has been a tireless champion for making sure Kings County does everything it can to help our patients living with diabetes. Thank you for being here today and for witnessing a renewed commitment to our community.
Good afternoon. I'm Dr. Michelle Allen, System Chief Medical Officer for New York City Health and Hospitals. It's an honor to be here in Brooklyn at Kings County, long a diamond in our crown of hospitals. Once again, Kings County is leading the way in treating chronic diseases. Diabetes, hypertension, obesity, stroke, really prevalent in our community here. And thanks to Dr. Pulitzer, Dr. David Stevens, Sheldon McLeod, and Opal Sinclair, we're bringing together the three legs of the stool that my tour guide shared with me: medication, exercise, and diet. We have a state-of-the-art kitchen here where we can learn how to cook based on our own ethnicities and what's culturally appropriate for us. There's a resource room for education and computer access to download the latest information. And there's an exercise, Pilates, treadmills, weightlifting, all the key ingredients. Those of us who are physicians here in the room know that we can write all the best prescriptions in the world, but without the engagement of the patient and the community, it's all for naught. Thank you, Kings County, for bringing the patients together with the team and providing this tremendous support. And for Dr. Mitchell Katz, our CEO, I want to say thank you, congratulations, and once again, it's an honor. Thank you.
I want to take the opportunity to thank Mr. McLeod for his leadership and his advocacy for the hospital also. And I want to take the opportunity to thank everybody from the staff, the doctors, the nurses, and the medical professionals, all of you, and those from the administration also, because we cannot function without them, right? Matter of fact, this is a very important moment at the City Council too. June, we are taking decision about the budget. We are trying to pull over here. I have a very strong discussion with the administration and to see that what else we can do to support the effort that we are doing. And I keep saying that all the time. We got good doctors, good nurses, dedicated health professionals, but if you don't have the resources that you need to do the job, you won't be able to do it. And that's exactly what I'm doing right now. So I don't know what the result will be, but I want to inform you that I'm working very hard to try to do the best I can do in order to support the wonderful job that you are doing. Thank you very much for the opportunity, and thank you for what you have done, what you are doing, and thank you for what you will be doing. And I know that because of you, my constituents and New Yorkers, their life will be better. Thank you very much. Thank you.
1, 2, 3, cut. All right. Congratulations.
afternoon. I'm David Stevens. I'm the Chief of Ambulatory Care at New York City Health and Hospitals, Kings County. For over 150 years, Kings County has been providing care to our patients in whatever way they need it. And in 2019, what they need us for is to help them with diabetes. Diabetes right now is one of the major health problems affecting our community here in central Brooklyn. Right now, diabetes is one of the major threats to the health of our community in central Brooklyn. Diabetes makes people feel ill, but more importantly, it increases their risk of heart disease and of stroke. It doubles the risk of stroke, and it almost doubles their risk of heart disease. And heart disease is the #1 killer of our community here in central Brooklyn. What we're trying to do is change the way we provide care, because we provide care for many years. We've provided care with great doctors and nurses, and now what we're trying to do is really give the responsibility back to the patient, to make sure we're here for them, to help them learn how to take better care of themselves. That means patients have to learn not just how to take the right medicines, not just how to check their sugars, but they need to know how to eat right in a way that they can do for the rest of their lives, to eat food that's good for them and will keep them healthy. They have to learn how to exercise. Many of our patients already are very active, but some of our patients are not active at all. So we have to teach them. In our new facility, we'll have a teaching kitchen to teach them recipes that they're comfortable with, recipes that feel like home, that they can learn to cook at home and help them sustain this diet for them and their family. We also have a gym, which is a teaching gym. We have staff that can teach patients how to use gym equipment, whether it's treadmills or bicycles or free weights. Our patients will learn how to do this so that this becomes part of their life moving forward. And one of the most important things we're going to do is start groups where patients can coach each other. Because it's one thing for a nurse or a nutritionist or a doctor to tell patients to eat a certain way, but when our patients hear from their friends and their neighbors how they were successful. In our new expanded diabetes center, we will have many services. We will have, for the full spectrum, we will have services to prevent diabetes, because in our primary care practice, we often recognize children and adults who are at risk for diabetes, and we will have a program called the Diabetes Prevention Program, which will be free to our participants. And there will be a year-long program where they will, in groups, learn how to eat better, learn how to exercise, and share with each other the skills that they've learned, and every week do check-ins to make sure they're on track. For newly diagnosed diabetes, often we will see patients coming in out of our emergency room who didn't know they had diabetes, and they need a quick route in to get the care they need. We have a program already in place for patients sent from our emergency department to get the medical management they need and the education they need. For patients who have had diabetes for a long time and are struggling with it and have not achieved good control, we have a diabetes practice run by diabetologists, endocrinologists, specialists who have extra training in diabetes, and they will get all the best medicines that they need for their medical management. And at the same time, when they come in for those medical visits, they will also be given education and support on their lifestyle using our teaching gym, our cooking classes, and everything else we have to offer. And then for patients who, for whatever reason, don't seem to be effective in getting their diabetes controlled through medication and lifestyle, but continue to struggle with their weight, we are embarking on a plan to implement a bariatric surgery practice. This is a method that's been shown in patients who are unable to lose the weight but are suffering from diabetes, to help them help them lose the weight, and in the process reduce their diabetes, and in some cases eliminate the diabetes. All these practices will be taking place all under one roof, so patients can get the care they need, and they can get the care when they need. The center will be open 5 days a week, and patients can come in when they have an appointment, but they can come in when they don't have an appointment, because diabetes is an all-year, everyday illness, and patients may decide one day that's the day that they want to get their diabetes better controlled, and they can come in on that day and get plugged in and get started on the route to recovery. So we welcome everyone in Brooklyn to get their care here. Those who are concerned about a new diagnosis of diabetes, those who've had it for many years, and those who are eager to never get diabetes. You can call, there's one number that anyone can call to make an appointment. The way in for most people will be just to start primary care here. And the single number to call is 718-245-3325. By calling that number, you can get started with primary care here, or you can get started with our diabetes prevention program. Thank you.